Okay, so for my checkout today, I have the 6-minute walk test. So to get started, I'm gonna wash my hands and then greet the patient. Before I even do that, I'm gonna make sure that she's in the appropriate attire for this test, make sure that she hasn't had a big meal, make sure that she hasn't conducted any vigorous exercise within 2 hours. Okay, so hi, Ms. McElroy. My name is Kurt Neild. I'll be your student physical therapist today.
Nice to meet you.
Yeah, and so how are you feeling today? Good? Okay, any pain today? Great. So what I'll do is start explaining. Today we're gonna do the 6-minute walk test. And what that includes is walking 100 feet in between 2 cones. I'll demonstrate a little bit later. And the point of the test is to see what your level of function is with your COPD and see if that's impacting your heart and lung, or to what level that might be impacting your heart and lung function. Okay, so if you're ready, you can stand up. At this point, before she actually gets started with the test, I would do a blood pressure and lung auscultation check. And then I'll get her staged. So Ms. McElroy, if you could stand by the first cone here. I'm gonna have a pulse oximeter on her, so I'll be able to take heart rate and pulse oximetry just by looking at that. And I'll take those values down for resting right now. And then I'll have her start the test. So if you want to get started, remember you're gonna, actually hold on one second. My demonstration would be around the nearest cone, so I don't have to walk all the way down 100 feet. You're gonna walk around the cone and try to turn as quickly as you can, and then continue. Okay, so at this point I'll have her start. You can get started. I'm gonna start a timer. I'm gonna be counting her laps. I will keep my eyes on the patient, and that's to check for any signs and symptoms of exercise intolerance. I'm going to be looking for chest pain, shortness of breath, leg cramping, if she's staggering, checking for diaphoresis, or generally a pale complexion, like she's not doing very well. Probably wouldn't have a dog with her too. So it's a working dog. So if she does have any of those symptoms, I'll have her stop the test, get her sitting or in supine. I'm gonna take her vitals and then get her O2, supplemental O2 if she needs it. Okay, so at this point, I would stop her at 6 minutes, wherever the test, whenever the test finishes, I'll stop her at that point on the 100-foot track, but for the sake of the video, I'll have her come over towards me. And once she gets here, I'm gonna have her continue marching in place. I'll record her heart rate and O2 sat levels. And then once she's done with that, she can sit down. We will take a post-test blood pressure. And then there are 2 scenarios on the checkout sheet that I'll talk to. The first was if she had DSAT in the 4th minute, I think. And so if that happens, terminate the test, sit her down, get her into supine if need be, and then give her supplemental oxygen. Since she has COPD, or since you have COPD, if that's the case, I'm gonna get you oxygen and try to see if we can get your O2 levels back to where we need. If she had leg cramping or dyspnea, we would have her sit down or get in supine and see if those symptoms resolved. At this point, I would let the patient know that the distance that she walked, where that puts her at functionality-wise, and then check for her understanding of the test. So how did that test feel to you?
Not too bad. I got a little tired.
Okay, great. And do you understand what everything kind of means in the end? Okay, great. So checking for that comprehension of the test and what the results mean to the patient. Okay, I think that's it.